Most students lose marks in competitive exams not because the topic is difficult, but because anatomy is not clearly understood. In this video, we will simplify the anatomy of the respiratory system in a way that you will never forget and that will directly help you in GPAT, NAPLEX, and OPRA and competitive exams. So, welcome to part 2 of anatomy of the respiratory system. In this part, we will focus on structure, lining, epithelium, key differences, and high yield exam points, exactly how questions are asked in competitive exams. Make sure you will watch till the end because the alveoli and nerve supply sections are extremely important for MCQs. Let's begin our journey of air from entry to exchange. So, now coming to the part 1, which is nose and nasal cavity. The nose is the external opening of the respiratory system and serves as the first passage for air. The functions of nose is which filters air using hairs, warm air using rich blood supply and moisten air using mucus. Whereas nasal cavity is divided by nasal spectrum and is lined by ciliated pseudostratified columnar epithelium. Please remember this point, lined by ciliated pseudostratified columnar epithelium, and it also contains turbinates which called as concave which increase the surface area. Here, the exam important points for this um, part 1 is epithelium is ciliated pseudo-stratified columnar. Function is filtering, warming, humidification. Turbinates increase surface area and rich blood supply. So, guys, during inhalation, the air will enter through nose. The next part is pharynx. Pharynx is a muscular tube that connects the nasal cavity to the larynx. It acts as a common passage for air and food, which makes it clinically very important. So, coming to the division of pharynx, pharynx is divided into three parts: nasopharynx, oropharynx, laryngopharynx. So, the nasopharynx is concerned only with respiration. So, oropharynx, common pathway for air and food. Laryngopharynx leads directly into larynx. So, here the epithelium is very important point. So, the nasopharynx is lined with ciliated pseudostratified columnar epithelium, whereas oropharynx and laryngopharynx are lined with stratified squamous epithelium to withstand friction from food. So here we have to focus on the exam points such as nasopharynx is only for the respiration, oropharynx is equal to air and food. Changes in epithelium is a frequently asked question. Pharynx is a common site of infections. Now the air enter into the next part which is called larynx. First the air will enter to the nose, nasal cavity, then pharynx, larynx, trachea, bronchi, bronchioles, then finally alveoli. So, larynx is also known as voice box. Larynx connects the pharynx to the trachea and is responsible for voice production. Cartilages of larynx is thyroid cartilage, cricoid cartilage, and epiglottis. The epiglottis acts like a lid and prevents food from entering trachea during swallowing. Failure of this mechanisms leads to aspiration. So, guys, I'm explaining a brief anatomy of larynx, how it acts during respiration. And to focus on exam points about larynx is voice production organ, epiglottics prevent aspiration, cricoid cartilage is a complete ring, and at the vertebral level location is C3 to C6. The next part is trachea. Now the air enter into the trachea, which is a rigid air passage extending from larynx to bronchi, and the length is approximately 10 to 12 centimeter, which is supported by C-shaped hyaline cartilage rings lined with ciliated pseudostratified columnar epithelium. And the mucociliary escalator traps and removes dust particle, which is an important defense mechanism. So here trachea is supported by C-shaped hyaline cartilage ring, whereas the larynx is only cricoid cartilage complete ring. Here C-shaped ring, in larynx is complete ring. And here it is lined by ciliated pseudostratified columnar epithelium, which is same seen in nasopharynx. So Exam focus points are C-shaped cartilage ring, prevent collapse during breathing, divided at carina, and mucociliary clearance mechanism. After trachea, now the air enter into the part called bronchi and bronchioles. The trachea is divided into right and left primary bronchi. Right bronchus, which is wider, shorter, and more vertical, whereas the left bronchus is longer and narrower. This is why foreign bodies usually enter the right lung. Bronchi is further divided into bronchioles, which lack cartilage and contain smooth muscle. To exam focus points for bronchi is right bronchus is for the aspiration risk, and bronchioles lack cartilage, smooth muscle present, asthma affects bronchioles. So far, we have clearly understood how air travels from the pharynx through the larynx and trachea and finally into bronchi and bronchioles. But here is the truth. Competitive exams like GPAT, NAPLEX, and OPRA don't stop here. Most high scoring MCQs are asked from inside the lungs, not from the pathway. Questions that decide your rank come from lung anatomy and lobes, alveoli, and surfactant, pulmonary blood supply, and clinical correlation that students often confuse. In part 3, we will go deep into detailed anatomy of lungs, alveoli explained with type 1 and type 2 cells, pulmonary artery and veins, which is simplified, and exam gold key points that are repeatedly asked. If you want to score, not just study, don't miss part 3. Subscribe, turn on bell icon, and be ready because part 3 is coming very soon. Part 2 was the pathway, part 3 where marks are decided.